I suppose if there are any other medications that aren't available for GPs that can be used for smoking cessations, in other words, if there's any trials that the oncologists are running, with regards to newer smoking cessation medication in the context of a specific type of cancer, that would be useful. But in terms of the pharmacotherapy and also the counselling, I think most of us are pretty happy with, I guess, the arsenal of medications that we have in terms of treatment. So if there's any newer products available, or any new trials where there's a specific trial for a new drug for smoking cessation, that would be extremely beneficial. What would be useful would be ease of access to specialists. I must say the majority of specialists are extremely helpful. If a GP has a query, usually they're contactable. If the staff specialist isn't contactable, normally the registrar is contactable. So the specialists really can't fault them. They're there to help, and we can get help from them. I was just thinking perhaps another option we have, because the specialists are extremely busy, the registrars are busy, the staff specialists are busy. Another option would perhaps be an oncology nurse who is trained up to give simple advice. And GPs just require simple advice, where when I'm a specialist, we need things to be nice and simple for us. And so, and obviously I understand that oncology nurses are very, very busy as well. But if there is, for example, an oncology nurse that's able to provide very quick advice related to the context of what we talked about today, and just standard advice, that would be useful. Often I find it's much easier, getting in contact with a nursing unit specialist. Sometimes, given how busy the oncologists are, and we don't want to bother the oncologist and the oncology registrar for very simple things as well. They're out there making big decisions with complex medications and a ward full of patients who are immunocompromised and all the rest of it. And often the questions we have are very simple questions. So if there's some sort of avenue, whereby if it is a little bit easier for an oncology nurse to be available and answer some of those simple questions, and obviously if they can't answer those questions, then we can be referred on.
I guess it would be useful to know whether there's any contraindications for any of the pharmacotherapy, particularly Champix, I guess. I don't know if I'd be doing right when somebody was, whether there is any, as much as you can when you at the point of prescribing. But look, I'm not an expert in chemotherapy, and I just can't stay abreast of it. It's too complicated, and often stuff is trial medication and things. So, often the argument becomes, well, stopping smoking is probably better than side effects, but you don't want to be cavalier about it. So if there's any contraindications to varenicline or any of the other, that's probably the biggest one. Nicotine replacement therapy I think is pretty benign